Good day to all students. Today we present to your attention a lecture on the hemodynamic disorders. Hemodynamic disorders are the typical pathological process due to changes of the blood volume in the bloodstream, its rheological properties, or exist of blood outside the blood vessels. Hemodynamic disorders can be divided into three main groups: disorders of the blood supply, its arterial hyperemia, venous congestion, and ischemia; disorders of the permeability of vascular wall, bleeding, hemorrhage, plasmaregia; and last, its disorders of the flow and state of the blood: stasis, sludge syndromes, thrombosis, and embolism. Arterial hyperemia is an increased blood filling of the tissue due to increased arterial blood flow. Arterial hyperemia is divided into general and local, as well as into the physiological and pathological. The most common cause of particular types of arterial hyperemia are the following: the general arterial hyperemia due to decompression, this total vacuum hyperemia due to the increased volume of circulating blood, plethora or increased number or RBCs, it's erythemia. Local physiological arterial hyperemia due to the increased functional activity of an organ or tissue, working arterial hyperemia due to the local mechanical, physical or chemical effects, due to the emotional stress; and a local pathological arterial hyperemia cause depends on the type of congestion. The pathogenesis of local pathological arterial hyperemia is based on the following factors, which can be more or less important depending on the specific type of congestion: disorders of vasomotor innervation, it's neurotonic and neuroparalytic, and disorders of tissue metabolism. Inflammation in the early stages of development and allergic reaction. Vasoactive substances, histamine, prostaglandins, bradykinin, and others, it's the immediate effectors. There are 6 main types of local pathological arterial hyperemia. It's angioneurotic hyperemia, collateral hyperemia, vacuum hyperemia, hyperemia after ischemia, hyperemia due to arteriovenous fistula, inflammatory hyperemia. Angioneurotic hyperemia occurs due to the stimulation of vasodilator nerves or paralysis of vasoconstrictor nerves. It happens in certain part of the body in cause of violation of innervation of the skin and mucous membranes on the face, or due to some infections affecting sympathetic nodes. Collateral hyperemia occurs due to the loss of blood supply through the main arterial trunks, for example, due to thrombosis or embolism, external compression. Then blood is redistributed through the collateral vessels. Their lumens are expanded refractory, and the inflow of the arterial blood increases. Vacuum hyperemia occurs due to the rapid reduction of the local barometric pressure. Examples are Minakov spots, which are the spots of dark red color detected at the endocardium of the left ventricle in the event of the death from acute massive blood loss. Enlargement of the left ventricle causes decrease in the barometric pressure in the endocardium tissue, resulting in excessive arterial blood flow in the vessels. Inflammatory hyperemia occurs due to the inflammation. It is subsequently transformed into the mixed arterial venous congestion and then into the venous congestion. Hyperemia due to arteriovenous fistula can be observed in cause of pathological anastomosis, formation between the arteria and vein. Hyperemia after ischemia, post-ischemic or post-anemic, occurs due to the rapid elimination of factors compressing the artery, swelling, fluid accumulation in the cavity, ligature, and others. Previously, ischemic vessels become expanded in overfilled with the blood, resulting both rupture and hemorrhage, and ischemia to other organs due to a rapid redistribution of the blood. The consequence and outcomes of arterial hyperemia may be positive, favorable, and negative, unfavorable. Positive: activation of metabolism, optimal cells activity condition, condition of high functional activity, working hypertrophy of the tissue or organs due to the prolonged, constantly repeating arterial hyperemia. And negative: rupture of the vessels and increased vascular permeability with formation of the hemorrhage. Systemic hemodynamic disorders in case of extensive arterial hyperemia due to the decreased peripheral resistance. Venous congestion is an increased blood filling of the tissue due to the reduced outflow of the blood. Blood inflow is not reduced or changed. Venous congestion is divided into the general and local, as well as into acute and chronic. The most common cause of a particular types of venous congestion are following: the general congestion, venous. Main cause is the heart disorders, heart failure, such as acquired or congenital heart disease, inflammatory heart disease, cardiosclerosis of different etiologies, myocardial infarction. Pulmonary disease accompanied by the decreased volume of the pulmonary circulation, such as emphysema, pulmonary fibrosis, pneumoconiosis, and others. Damage to chest pleura of diaphragm accompanied by a violation of pump function of the chest, such as pneumothorax, determinates of the chest and spine. And local venous congestion occurs due to the distributions of the blood outflow through the veins as a result of thrombosis, compression, or embolism. Obstructive venous congestion occurs due to the closing of the lumina of the vena by thrombus or embols. Venous congestion of the lower extremities due to thrombophlebitis. Venous congestion of the gastrointestinal tract due to portal vein thrombosis. Nutmeg liver due to the thrombosis of the hepatic veins. Cyanotic induration of the kidney due to the thrombosis of the renal vein. Compressive venous congestion occurs due to the acute or chronic compression of the veins from the outside by ligature, tumors, scar tissue, or inflammatory exudate. And collateral venous congestion can be observed due to difficult in blood outflow through the venous trunk. The morphogenesis of the acute and chronic venous congestion comprise a number of major factors. Acute general and local venous congestion. There is an increased microvascular permeability as a result of hypoxia and increased hydrostatic pressure of the blood in the overfilled veins, leading to edema, plasmatic impregnation, stasis, and multiply petechia. There are dystrophic and necrotic changes due to hypoxia. Acute venous congestion. syndrome is characterized by edema. The most significant clinical and morphological manifestation of the acute venous congestion is the pulmonary edema. Macro preparation: the weight and the volume of the lung is greatly increased. The surface is smooth and polished. There are depression from ribs. Color is mottled, light pink emphysema areas alternate with dark red blushing areas. On a cut surface, lung tissue is mottled with blushing red color and full-blooded. Pink form liquid drains from the cut surface. Portion of the lung sink in water. Micropreparation: accumulation of the eosinophilic homogeneous serous fluid in the interstitial tissue and alveolus cavities is absorbed in the lung tissue. The alveolus lumen are widened and wall are thinned due to compression. There is severe venous congestion. Exfoliated alveolocytes and RBCs can be seen in the lumen of the alveolus. General and local chronic venous congestion: there are the same factors as in acute venous congestion, and plus growth of connective tissue, it's fibrosis, and plus atrophy. A long-term chronic venous congestion leads to chronic hypoxia, resulting in the capillary parenchymal block. Morphology of the chronic venous congestion: its chronic venous congestion is characterized by edematous syndrome, anasarca. You can see on the picture it's a widespread swelling of the subcutaneous fat. Hydropericardium, hydrothorax, ascites is the accumulation of the serous fluid in the serous cavities. Cyanosis: skin, especially on the lower extremities, become cold and blushing in color. Skin and subcutaneous veins are expanded and filled with blood. Hydrocele is the accumulation of serous fluid in the serous cavities of the testicles. All the internal organs in chronic venous congestion become firm due to the growing of stromal collagen fibers, resulting in cyanotic induration of the organ. Macro preparation: it's cyanotic induration of the kidney. Kidney become enlarged and dense with smooth surface. Cortex on the section look pale blushing, and medulla look dark blushing. Micro preparation: there is a dilatation and hyperemia of the glomerula and peritubular capillaries, and dystrophic lesion of the control tubular epithelium, and the excessive proliferation of the connective tissue is observed in the stasis kidney. The most frequent cause of stasis kidney are cardiac insufficiency, thrombosis, or the renal vein compressions, tumor, metastasis, aortic aneurysm, maybe. Macro preparation: the lung is large in weight and volume, has a dense consistence, and the section surface has a brown color. The porosity of the parenchyma is decreased. The increased consistency of the lung is due to the excessive proliferation of the connective tissue in the alveolus wall. It's colored to the accumulation of hemosiderin pigment. The decreased porosity is due to the thickening of alveolar septa because of hyperemia and sclerosis of the vessels. Micropreparation: the interalveolar septa are thickening affected by sclerosis. The veins and capillaries are dilated and hyperemic with thickened wall. The alveolar spaces contain phagocytes, cells filled with hemosiderin granules. Some alveoli contain edema liquid, and the whole erythrocytes are or part of disintegrated erythrocytes. Stasis hyperemia of the lungs, it's seen most frequently in cardiac insufficiency, especially in mitral stenosis. Due to this fact is also called cardiac lungs. Macrophages with hemosiderin granules in their cytoplasm can be found in the sputum of patients with cardiac insufficiency and are called cardiac cell. Diapedetic hemorrhages, hemosiderosis, and the proliferation of connective tissue are linked to venous tissue hypoxia, which determine the increase of vascular permeability and the synthetic activity of the alveolar septal fibroblast. And the second slide, you can see the special stain on the iron or reaction of the pearls. It's you can see granular of pigment hemosiderin. Its color is blue. Macro preparation, it's nutmeg liver. The liver is large in size and weight, has a spread smooth capsule, increased consistency, and a rounded anterior margin. On section, a very accentuated lobular aspect is observed, a variated characteristic aspect, which resembles in the America nutmeg. This is due to the alteration of some small puntiform foci of dark red color, central lobular zone of hepatic lobulus, mixed with others of a brown-yellow color, peripheral zones of the lobula. This variated aspect of liver is due to the particularities of the liver blood circulation and of the organ architecture. Is the most frequently seen in right cardiac insufficiency, great circulation stasis. And analogy can involve in the thrombosis of the hepatic veins. Micropreparation, the central veins of the hepatic lobula and the adjacent portion of the sinusoid capillaries are dilated, filled with blood. In the central of the lobula, diapedetic hemorrhages can be observed blood lakes. The hepatocytes atrophied. The central portion of the hepatic tuberculous are thin, almost liana. Macroscopically, there is pericentral lobular zones have a dark red color. In the intermediate zone of the lobula, fat dystrophy of the hepatocytes can be observed. Macroscopically, they have a brown-yellow color. In the peripheral zone, the sinusoidal capillaries and the hepatocytes are not divided, and the trabecular structure is unchanged. Macroscopically, the color of this zone is brown-red, the normal appearance of the hepatic parenchyma. Selective hyperemia of the central zones of the lobula is explained by the fact that venous stasis involves firstly the hepatic veins, then lobular level, the central lobular veins, and the neighboring portion of the sinusoid capillaries. The stasis does not extend to the lobular periphery due to the great blood speed and pressure in the peripheral zones of the sinusoid capillaries, where the arterial capillaries of the hepatic arterial system penetrate. Because of this, the central of the hepatic lobula is hyperemia, while periphery is not affected by hyperemia. Chronic venous hyperemia leads to stasis, cirrhosis, or cardiac of the liver. The consequence and outcomes of the venous congestion, it's suppression and perversion of the metabolic process in the congested tissue, resulting in decreased functional activity of the organ and tissue. Atrophy of the parenchymal cells in chronic venous congestion, growth of connective tissue, sclerosis of organ in chronic venous congestion, vascular insufficiency, collapse due to the acute deposition of the large quantities of the blood in the capacitance vessels, dilatate in case of extensive venous congestion. In case of timely elimination of the cause, venous congestion is a reversible process. Otherwise, atrophy and sclerosis of the organs happens, leading to the functional failure of the organ. Ischemia. Ischemia is a disorder's blood filling of the tissue, organ, or part of the body as a result of poor blood supply, loss of the blood supply. Ischemia can be divided into general and local, as well as into acute and chronic. Macroscopically, the organ is reduced in size, has a decreased temperature and a pale color. The effect of ischemia depend on many factors. Among them, the main factors are the rapidity of obstruction, once it's sudden or slow, gradual, the step of obstruction, the level of obstruction, and the causative factors, the state of collateral circulation, duration of obstruction, the tissue sensitivity towards the lack of oxygen, the state of tissular metabolism, and the functional state of the organ at the moment of ischemia. Depending on the cause of and condition, the types of ischemia are following. Angiospastic ischemia is caused by a spasm of the arteria due to the action of virus cause, nervous, hormonal, or medical in nature. Obstructive ischemia is a result of blockage and narrowing of the lumen of the arteria by thrombus embols, as well as due to the proliferation of the connective tissue or narrowing of the lumen by the atherosclerotic plaque. Compressive ischemia is a result of compression of the arteria from the outside by ligature, inflammatory exudate tumor, and others. And ischemia due to the redistribution of the blood occurs due to the rapid redistribution of the blood. For example, cerebral ischemia can be formed after rapid removal of ascites fluid from the abdominal cavity. In the case of acute ischemia, there is complete substantial and sudden occasion of the arterial blood flow to the organ, resulting in degeneration and necrosis changes. Chronic ischemia, when there is a prolonged and gradual decrease in arterial blood flow, resulting in atrophy of the parenchymal cells and sclerosis of the stroma, which are a reflection of the response to chronic hypoxia as compensatory and adaptive process. Example of such changes can be diffuse cardiosclerosis and primary shrunk kidney. The consequence and outcomes of ischemia in the case of timely elimination of the cause ischemia is a potentially reversible process. Ischemia can be returned to normal. Otherwise, necrosis in acute ischemia or tissue atrophy in chronic ischemia develops. The outcomes and importance of ischemia difference and depends on the following factors: its severity of ischemia and its duration, extent of collateral blood supply. The more development the collateral network the less severe the consequence of ischemia. Status of the collateral arteria, the worse condition of collateral arterias, the more severe the consequence of ischemia. Functioning of the cardiovascular system, the development of the collateral blood flow requires effective central hemodynamic, and the rate of occurrence of ischemia, the more sudden ischemia, the more severe consequence, since this will be not enough time for the development of compensatory reaction and activation of the collateral circulation. And susceptibility to ischemia due to future of the metabolism, some organs and tissue of extremely susceptibility of to ischemia, brain, myocardium, while others are less susceptible, skeletal muscles, bone, and others. Metabolic rate, the low the metabolic rate, the less effects of ischemia. For example, hypothermia, slowing the rate of ischemia injury. In the next part of our lecture, we talk about disorders of vascular permeability. Disturbance of the permeability of the vascular wall are pathological condition caused by the disorders of the vascular wall, leading to violation of its integrity and permeability. In pathological condition, disturbance of the vascular permeability are often characterized by the increased permeability and include two main types: bleeding and plasmorrhagia. Bleeding or hemorrhage is an exist of the blood from the lumen of the blood vessels of the cavity of the heart into the environment. External bleeding, body cavity, it's internal bleeding or tissues, extravasation. According to the etiopathogenesis classification, there are three main types of the bleeding. Bleeding due to the rupture of the vascular wall. It's caused by the injury of necrosis of the vessels, inflammation, and others. Bleeding due to the ulceration develops due to the destruction of the vessels wall due to inflammation, usually purulent, malignant tumors, necrosis, caseous necrosis, and bleeding tuberculosis cavity. Exposed to chemical gastric juice can cause bleeding from stomach ulcer. Bleeding from the fallopian tube and cause of ectopic pregnancy. And last, bleeding due to the increased permeability of the vascular wall. It's the exist of the blood cells into the extravascular space due to the increased vascular permeability with preserved integrity of the wall of the blood vessels. It occurs in severe hypoxia, intoxication, infections, virus, and hemorrhagic diathesis, and often diapedesis hemorrhages can be seen in hypertensive crisis, systemic vasculitis, leukemia, hemophilia, or uremia. There are several types of bleeding. External bleeding is an exist of the blood from the vessels into the environment, gastrointestinal bleeding, for example. Internal bleeding is an exist of the blood from the vessels into a body cavity, maybe, for example, hemopericardium, hemothorax, and hemorrhages into the surrounding tissue. Hematoma is a hemorrhage with a loss of the integrity of tissues and with the formation of cavity. The hemorrhagic focus contain clusters of RBCs around the vessels, which wall is damages. RBCs in hematoma are often poorly visualized and appeared as pale and partly lysed cells. About a day after hemorrhage, macrophages loaded with hemosiderin, local hemosiderosis, can be seen in its periphery. In all the hematomas, organization can be seen growth of granulation and fibrous tissue, calcium deposits up to the formation of the bone. Hemorrhagic, you can see hemorrhagic infiltration is a kind of hemorrhage with preserved integrity of tissue. This ecchymosis is a planar bleeding in the skin, subcutaneous tissue, and the mucous membrane. And these, you can see, petechia are the point-like hemorrhages in the skin, mucous, and serous membranes or internal organs. Outcomes of the hemorrhage: its resorption of the extravasate blood tissue, repair, replacement of the hemorrhage by the connective tissue or organization, petrification, ossification, cyst formation, encapsulation, and separation of the hematoma. Significance of bleeding according to its type, severity, and duration. Significant bleeding can lead to acute ischemia and hypovolemic shock. On the other side, prolonged bleeding from a small chronic gastric ulcer or duodenal ulcer leads to the development of chronic post-hemorrhagic hemorrhagic anemia. Localization of the hemorrhage is not less important. The most dangerous bleeding are in vital organs and organs located in the closed cavity. Bleeding in the brain, maybe. The normal state of the blood within the vessels is maintained by the hemostasis, reflecting in the interaction of force system: coagulation, fibrinolysis, endothelial cells, and platelets. Flow disturbance and the state of the blood, stasis, large phenomena, thrombosis, and embolism is the cause of main serious disease. What is its stasis? Stasis is the stopping of the blood flow in the vessels, macrovascular in any area, mainly in the capillars and postcapillars, venous. The basic mechanism of the stasis is due to the important changes in the blood rheology, which are presented by the intracapillary aggregation of RBCs. It leads to increased resistance to the blood flow through the capillaries, slowing down and stopping of the blood flow. Hemolysis and coagulation do not occur in stasis. The rheological properties of blood in the macrovessels are mainly determined by the ability of aggregation of RBCs that can clump together to form a roll and polymorphic conglomerate. The cause of stasis are dyscirculation disorders that can be caused by physical factors, chemical factors, infections, disease, allergic and autoimmune disease, and cardiovascular disease. The following factors can contribute to the development of the intracapillar platelet aggregation: changes in the capillaries leading to the increased permeability in plasmaregia, violation of the physical and chemical properties of RBCs, changes in blood viscosity due to the coarse fraction of proteins, disorders of the blood circulation such as venous congestion and ischemia. Stasis is manifested by the presence of delayed microvessels filled with a homogeneous mass of RBCs that stick together as a roller and polymorphic conglomerate. Stasis should be differentiated from the sludge phenomenon. Sludge phenomena is a phenomenon that is characterized by adhesion, aggregation, and agglutination of the blood cells, resulting in the separation, dividing of the blood on into the conglomerated of red blood cells, RBCs, with blood cells, YBCs, platelets and plasma, as well as violation of the microcirculation. Clinically, sludge phenomena is characterized by the increased ICR. As a local process, sludge develops in the pulmonary veins in such condition as shock lungs and acute respiratory insufficiency, respiratory distress syndrome. Stasis is a reversible phenomenon. Transition states, especially in tissue with a low sensitivity to hypoxia, can be resolved without any significant consequence. Prolonged stasis lead to hypoxia or of tissue and blood vessels even when blood flow is restored. There are multiple hemorrhages by the epidesis and rupture of the microvessels. Outcomes of the prolonged stasis of the blood in the tissue with the high oxygen consumption of degeneration and necrosis. Thrombosis is the in vivo blood coagulation in the lumen of the vessels or cavity of the heart, leading to the formation of the fibrin clots, including blood cells. The formed blood clots is known as the thrombus. There are various reasons that lead to thrombosis. However, they can be divided into local and general factors. Thrombogenesis. Local factors are the changes in the endothelial cells of the vascular wall, slowing and disruption of the blood flow. General factors are the imbalance between coagulation and anticoagulation systems of the blood, changes of the blood composition, and increased viscosity. According to the above mentioned factors, the increased risk of the thrombosis can be seen in the following situations. It's a prolonged bed rest after surgery, chronic heart failure, atherosclerosis, malignant tumors, pregnancy, and congenital or acquired hypercoagulation. Pathogenesis of the thrombosis is based on so-called Virchow triads. Damages of vascular wall, vascular endothelium. It stimulated platelet adhesion and activity of coagulation cascade. It's the dominant factors cause blood clotting in the arteries, and it's less important in the formation of the blood clots in the veins and macrovascular. And the next, slowing of the blood flow and turbulence blood flow. And last, it's an increased coagulation of the blood due to the changes in physical and chemical properties of the blood. And it's significant factors for the venous thrombosis. Depending on the location and the condition of the formation of the thrombus, the following types of the thrombi can be distinguished. White thromba, composed of platelets, fibrin, and leukocytes, are formed in rapid circulation, mainly in arteries. Red thrombus, it's composed of platelets, fibrin, and red blood cells, are formed in slow blood flow, mainly in veins. Mixed thrombi consist of the head, it's white thrombus, which is attached to the vascular wall, the body, mixed thrombus, and tail, the red thrombus. Such structure of the mixed blood clots is caused by a gradual slowdown of the blood flow progressively as the blood clots grows. So at the time of the tail formation there are optimal conditions, slow blood flow and turbulence for RBCs, sedimentation between the strains of fibrin. And hyaline thrombi are rare variant comprised of the destroyed of RBCs, platelets and proteins formed in the microvascula. Due to the relation to the vascular lumen of the following can be designated. It's parietal thrombus, obstructive thrombus when the lumen is closed due to the mass of the thrombus, axial thrombus, which is located along the axis of the vessels or heart chambers. And outcomes of the thrombosis is there are favorable and unfavorable outcomes of the thrombosis. Favorable outcomes, it's aseptic autolysis, is an ideal favorable outcomes leading to the complete destruction of the blood clots due to the activation of the fibrinolytic system. Organization of the thrombus. Thrombus is replaced by connective tissue which grows from the intima. Process of the organization may be accompanied by recanalization and vascularization. Slow lysis of the thrombus is following by the ingrowth of the connective tissue. Cracks can be formed within the thrombus that look like vascular channels lined with endothelium. It's recanalization where the blood flow can be restored to some extent. Calcification or petrification of the thrombus is a relatively favorable outcomes which is characterized by the deposition of calcium salt in the thrombosis. Sometimes in the veins such a process can lead to the formation of the stones or phlebitis. Unfavorable outcomes, it's thrombus detachment with the development of the thromboembolism. The next, septic autolysis is an unfavorable outcome which occurs when the blood clots become infected from the blood of vascular wall. It is accompanied by the development of septic hyperemia. Generally, the effects of the thrombosis are determined by the rate of its development, localization, and extent. Occlusive thrombi in the veins lead to chronic venous congestion. Thrombi in arteries leads to ischemia, up to ischemia or necrosis or infarction. Concerns of the thrombus are due to the possible complications. Differentiation between antemortem thrombi and postmortem clots. Thrombus and postmortem blood clots can be distinguished microscopically. Thrombus is dry, rough, dense, and crumbly. It's usually connected to the vascular wall, may or may not correspond to the contours of the vessels. There are Zachnus lines on the surface. Postmortem clots, it's like a jelly, soft and flexible. It lines freely in the lumen of the vessels or heart chambers. It takes the form of the vessels or its bifurcation, the surface in the smooth, yellow or red. There is a clots in the lumen of the vessels composed of fibrin in the from dense fibrous pink masses or thin fibers forming a loose mesh. There are some white blood cells and red blood cells among fibrin. Agglutinated and disintegrated platelets can be seen as loose, poorly stained, grainy mass. Zachner's line can be observed, the alternating more light areas of fibrin and platelets and dark areas of erythrocytes clusters. Disseminate intravascular coagulation, DIC, is the formation of disseminated blood clots in the macrovascula combined with a lack of blood clotting leading to a massive multiply hemorrhage. DIC is based on the incoordination of the blood coagulation and anticoagulation system. The main characterized by DIC syndromes are these phase changes of hemostasis, hypercoagulation followed by hypocoagulation, blockage of the macrovascula by the aggregate of blood cells and microthrombi, and hemorrhage syndrome. DIC complicates the course of many disease and pathological processes, including infections, especially generalized, including sepsis, all kinds of the shock, intravascular hemolysis, malignant tumors, especially leukemia, thermal and chemical burns, autoimmune disease. The direct cause of DIC include both endogenous and exogenous factors of the activation of hemostasis. Endogenous factor is tissue thromboplastin, the composition product of tissue and blood cells, a leukocyte protease damages and and the exogenous factors is infections, agent, bacteria and others, and drugs. Above mentioned mechanism of DIC are in close causal relationship and are the essence of clinical and morphological stages of DIC syndromes. The first stages is stages of hypercoagulation and aggregation of blood cells, and the second stages is transitional stages with increased consumption of coagulation factors and thrombocytopenia, and the next stages it's a hypocoagulation with activation of fibrinolysis system, and last stages is stages of recovery or outcomes and complication. The first and the second stage DIC on the background of vascular lesions, swelling and desquamation of the endothelium, plasma infiltration, fibrinoid swelling and fibrinoid necrosis, aggregation of platelets and red blood cells, sludge phenomena occurs. There are single microthrombi in the microvascular predominantly of the kidney and lungs. The next stage of DIC, there is aggregation sludge of the blood cells, fibrin, hyaline or mixed thrombi, fibrin deposits of the vascular wall, and small focal petechia on the serous membranes, mucous membranes, and internal organs and skin. And the last stages of DIC, there are degenerative changes with disseminate small focal necrosis in the kidney, myocardium, liver, pancreas, and others. And also there are foci of the hemorrhage in adrenal glands and gastrointestinal tract and brain. It cause of adequate treatment prognosis on the first and the second stage is favorable, on the third stage questionable, and on the last stage of DIC unfavorable. Thromboembolism is a typical pathological process caused by the presence and circulation of abdominal cavity. Particular is blood, often causing the occlusion or blockage of the vessels with the loss of the local blood supply. These particular are known as embol. Types of embolism according to localization: small blood circulation, large blood circulation, and system of vena porta. According to the material of the embols, it's thromboembolism, tissue or cellular embolism, bacterial embolism, embolism by foreign bodies, and fat embolism, amniotic fluid embolism, and air and gas embolism. According to the direction of the movement of the embol, there are orthograde or direct embolism. It's movement along the blood flow from the venous system of the systemic circulation, embolism of the pulmonary arteries. From the left chambers of the heart or aorta, embolism of the arteries of the systemic circulation, and from the veins of unpaired abdominal organs, embolism of the portal vein system. Retrograde embolism against the blood flow in the vena cava inferior, usually embolism by the foreign bodies when movement on the embolism is toward gravity but against the blood flow. And last, it's paradoxal embolism. Embol come from the veins of the systemic circulation but do not pass to the lung and clog the arteries of the systemic circulation. This is possible only when there is a communication between the atria, foramen oval, or between the ventricle of the heart. Thromboembolism. It's the most common form of embolism. It's characterized by the detachment of the blood clot or its fragment following its transfer to the blood flow. The most frequent localization of the source thrombi in thromboembolism is the veins of the systemic circulation. It's veins of the lower limbs. Such thromboemboli pass to the blood vessels of the pulmonary circulation, causing potentially life-threatening condition known as pulmonary thromboembolism. Most frequently, pulmonary embolism is observed in a condition that predisposes to the occurrence of phlebothrombosis. It's surgeries, early postoperative periods, early postpartum periods, prolonged immobilization, heart failure, and use of oral contraceptive and others. The source of thrombi in cause of the pulmonary embolism, it's typically congested veins of the low limbs and pelvic veins. Detached thrombus passes to the blood flow through the right side of the heart and falls into the pulmonary artery and its branches, resulting in obliteration of the lumen of the blood vessels. Effects depend on size, quantity of emboli, pulmonary reaction, and thrombolytic activity. Large emboli damage perfusion of the lung, resulting in impaired gas exchange and development of hypoxia. As a response, there is a reflex in narrowing the lumen of blood vessels in the pulmonary circulation, followed by the increased pressure in the pulmonary arteries. In cause of massive thromboembolism, the pulmonary coronary reflex can be developed. The mechanical impact of the thromboembols on the intima of the pulmonary artery arteries leads to the spasm of the coronary arteries and cardiac arrest, which is accompanied by the bronchial spasm with the development of the acute respiratory failure. Thromboembolism is often located in the lumen of the pulmonary trunk in the form of glomus, or it then pass into the two main branches. It look as a dense, crumbly, dry, brown, and not associated with the vascular wall mass. In case of the thromboembolism of small and medium branches of the pulmonary artery, volume of the lung is increased, and there are multiplied thromboemboli in lumen of medium and small arteries on the cutting surface. Lung looks swollen and congested. There are foci of hemorrhages and hemorrhagic infarction. Microscopically, thromboembols consist of two alternating layers called Zachner lines. It's platelets and fibrin and erythrocytes. Within the pulmonary tissue, there are hemorrhagic infarction, leukocyte infiltration, dysatelectasis, atelectasis, edema, and hyperemia. Fat embolism, its cause is extensive trauma with the destruction of the subcutaneous fat, fracture of the long tubular bones, surgeries, or intravenous administration of fat-containing substance. Massive fat embolism result in acute respiratory failure. Special stain methods of the histological slides and on the lungs show presence of the fat droplet in the capillaries of the intra-alveolar septa. Less severe fat embolism usually has a favorable prognosis. Embolism by foreign bodies. It's embolism due to the fragment of splanchnitis, bullets, and others bodies, catheters and needles. Maybe it often leads of the development of retrograde embolism due to the heavy mass of embol. Also, this type of embolism including resulting from calcification and conglomerates of cholesterol crystal and atherosclerosis. And amniotic fluids embolism. This is the most serious, unpredictable, and unpreventable cause of maternal mortality. During labor and in the immediate postpartum periods, the contents of amniotic fluids may enter the uterine veins and reach right side on the heart, resulting in fatal complication. Notable changes are seen in the lungs, such as hemorrhages, congestion, edema, and changes of air DC, and dilatation of right side of the heart. These changes are associated with identifiable amniotic fluid contains with the pulmonary macrocirculation. The cause of death may be a result of the following mechanism: mechanical blockage of the pulmonary circulation, anaphylactoid reaction to amniotic fluid, and dissemination, intravascular coagulation, and hemorrhage manifestation due to thrombocytopenia. Air and gas embolism, it occurs when the free air appears in the bloodstream. Cause are open heart surgeries, wounds of the large veins of the neck and chest, postpartum periods, accidental administration of the air in the vein, and rapid decompression. Ear emboli may pass through both venous and arterial system that may determine the clinical and morphological pictures. As an example, the ear embolism passes through the venous blood into the right atrium and then into the pulmonary circulation. Puncture of the right atrium under the water on autopsy allow exit of air from its cavity. Decompression thinkers is caused by sudden changes in atmospheric pressure. The acute decline in pressure leads to the release of gas dissolved at relatively high pressure in the blood. In this case, a lot of gas bubbles appear in the bloodstream. And bacterial embolism. It's embolism due to circulating bacteria, fungi, animal parasites, or protozoa. As an example, septic autolysis of thrombus can be happening at the site of vascular occlusion, microbial emboli from metastatic abscess. In case of embolism of the pulmonary blood vessels in the lung, in case of embolism of greater circulation vessels in the kidney, spleen, heart, and other organs. And last, it's a cellular or tissue embolism cause are this is tissue damage due to trauma or disease, fragments of the heart valves in ulcerative endocarditis, brain trauma, amniotic fluid embolism, embolism by cancer cells from metastasis. Most tissue embolism occurs in the vessels of the greater circulation and less number in the vessels of the pulmonary circulation. And thank you for your attention and goodbye.